Hey guys, thanks for joining. Today's video is going to be on A in ADME, or absorption. Thanks for watching. Absorption can be thought of what's happening at the cellular level after administration has occurred. It's the process by which a drug enters the bloodstream. It's important to understand so that we can conceptualize pharmacokinetics. It's the initial step in determining bioavailability, which we'll get into later, and determining the therapeutic effectiveness of a drug. Let's look at some major factors affecting absorption. There's three important factors determining absorption. These are the size of the molecule, the pH, and if it's ionized or not. Let's start with pH. pH of a drug tells you whether it's acting as an acid or a base. Acids have a lower pH, bases have a higher pH. Acidic drugs will be absorbed in an acidic environment more easily. Basic drugs will be absorbed in a more basic environment more easily. Any drug that has a pH closer to 1.5 or 3.5 will be absorbed in the stomach. Drugs that are more basic, so higher than 3.5, will likely be absorbed in the small intestine, which has a higher pH. Another factor is particle size. Larger molecules dissolve more slowly, have a difficult time crossing the membrane, and are absorbed at a slower rate. Smaller molecules dissolve quickly, can cross the membrane more easily, and are absorbed faster. Ionization, or the degree of ionization, also affects how drugs are absorbed. Does the drug have a positive charge, a negative charge, or is it neutral? Cell membranes are made up of fats or lipids. They're not charged, or they're net neutral. Ionized drugs either have a positive or a negative charge. Charged molecules do not cross a membrane easily. Molecules that aren't charged, that are neutral, will be absorbed more easily. They're able to cross the lipid bilayer. This is especially important in drug development, in which drugs can cross the blood-brain barrier. There's other patient-specific factors that can affect absorption. For instance, age. With increasing age, gastric motility slows down. Gastric motility slows down, this can decrease the rate of absorption for some medications. Disease state. In critically ill patients, there's decreased blood flow to the GI tract, which can also decrease absorption. Thirdly, the contents of the stomach, like food or other medications, can also increase or decrease the rate of absorption. At the cellular level, we look at the mechanisms of absorption. How does the drug cross the membrane? First, we have passive diffusion. This is when a drug moves from a high concentration to a low concentration to establish equilibrium. In this case, no energy is required. Next, we have facilitated diffusion. This is when a drug binds to a receptor or uses a protein embedded within the membrane to cross the membrane. In facilitated diffusion, there's also no energy required. With active transport, the drug uses a membrane-bound protein. It binds to the protein, and then the protein and drug complex translocate across the membrane where the drug is then released. This does require energy to complete the task. First pass effect or first pass metabolism can significantly affect how much of the active drug is available to bind to receptors. Medications, when they're taken orally and absorbed, are sent to the liver within the blood. In the liver, which is the primary site for metabolism, the drug can be changed by enzymes, specifically cytochrome P450, and other enzymes by the addition or removal of certain functional groups. These functional groups alter the chemical structure, usually making it more hydrophilic and facilitating some sort of excretion, either fecally or through the urinary tract. At this point, you'll now have both the changed drug and the unchanged drug in circulation. The drug that's changed and has been facilitated towards excretion will get filtered out. The drug that's unchanged will be able to bind to its intended receptor and cause a therapeutic effect. The unchanged drug is now bioavailable. That's the proportion of the drug that is able to carry out the effect. The other 50%, since it's been facilitated by metabolism for excretion, will be eliminated from the body without producing a therapeutic effect. In this instance, the bioavailability of this drug is 50% or 0.5. So we can think of bioavailability as the amount of drug that it's administered that after absorption and metabolism is available to produce a therapeutic effect. This video had a lot of material to cover. In summary, we need to look at the size, the pH, the ionization of the drug to determine how and how much of it might be absorbed. We also need to look at the patient and consider their age, the degree of illness, and if there's any food or drug interactions that might speed up or slow down the rate of absorption. In terms of absorption, size does matter. Smaller molecules are going to absorb more easily compared to large molecules. The charge also matters. Positively or negatively charged ions will not absorb or cross the membrane as easy as neutral molecules. The stomach has a lower pH, meaning it's more acidic of an environment. Acidic drugs are going to be absorbed more readily in this area. The small intestine, while still somewhat acidic, is less acidic than that of the stomach. So drugs that are more basic will be absorbed in the small intestine. Understand the differences in absorption at the cellular level, the difference between passive diffusion, facilitated diffusion, and active transport. Which ones require energy and which ones do not. First pass effect or first pass metabolism only happens for medications that are administered orally. Eventually, they make their way to the liver, where they can be metabolized or changed by certain enzymes, specifically cytochrome P450 enzymes, which usually make the molecule more hydrophilic and more water soluble so that it can facilitate excretion of the drug. This then impacts the bioavailability of a drug. Bioavailability refers to the amount of drug that's been ingested and that's gone through metabolism but isn't changed. This drug is the leftover proportion that's still able to carry out the physiologic function. We covered a lot of information in this video. If you have questions, go ahead and leave a comment. Otherwise, let's go through some review questions to see how much you've retained. Which of the following is true regarding the first pass effect? The answer is C. It involves the metabolism of the drug in the liver before reaching systemic circulation. Which form of a drug is generally absorbed the fastest? In this case, it would be a small tablet. A. What is bioavailability? The answer is B. The extent and rate at which the active drug enters systemic circulation. Which of the following can slow the rate of drug absorption in the stomach? The answer is B. Delayed gastric emptying. Which of the following is a characteristic of drugs that are well absorbed through passive diffusion? The answer is C. Lipid solubility. Thanks for watching. Don't forget to comment, like, or subscribe on the video. For more pharmacology-related content, make sure you search for SimplePharm pharmacology videos.